Hi guys, welcome back. So today I am going to talk about how massage can be used to help clients with multiple sclerosis. Now, this is a subject that, a lot of even therapists think that multiple sclerosis is immediately a contraindication to massage. However, it does have its uses. What I would say is, like with so many of these medical issues, if you're going to have a massage for this, make sure that you see a registered therapist who has experience in this area. Because your average therapist will not have the knowledge of this enough to be able to treat you without the possibility of pushing you back into out of remission, or so obviously no one wants treatment that's going to do more damage than good. Now, multiple sclerosis is an autoimmune inflammatory condition where basically there's inflammation and degeneration of the myelin sheath, which covers the nerves. It's a progressive, disease of the central nervous system, which affects how the brain controls normal bodily functions, even things like walking or just everyday things, that you would normally do. There may be periods of remission, but following each inflammatory response, there will be the formation of new scar tissue, which obviously further damages not only the muscle tissue, but also it further damages, neurological function, affecting the spinal cord, the brain, and the cranial nerves. So, as I've said, while often seen as a contraindication to massage, massage can be beneficial to those with MS, reducing stress, relieving pain, and just helping to maintain function. So if we look at the signs and symptoms of MS, probably the biggest one is fatigue, weakness, and spasms. There may be changes in sensation. Now, this could be complete numbness, paresthesia, or it could be just a slightly reduced sensation. Quite often there will be loss of coordination, muscle stiffness, difficulty walking, and doing other just daily activities. There may also be loss of cognitive function. There may be depression, sexual and neurological dysfunction, digestive issues, optic neuritis, something called Lermit's sign, which is basically where it's like an electrical sensation where which happens when the neck is in flexion. And it can be, obviously we've said, you can sort of relapse and you can go into remission. But there's also, it can be referred to as benign or malignant. So with benign MS, you only get one flare-up. With malignant, this is a rapidly progressive, form of the disease. In terms of treatment, it really depends on what symptoms you are experiencing. Potentially steroids, immune suppressants, exercise and physical therapy for maintenance certainly will make a difference, although it may not always be easy to for someone with MS to actually, do any form of exercise. The benefits of massage for MS. So certainly, as we always say with massage, pain relief by reducing the inflammatory response, improving range of motion, reducing those muscle spasms. MS patients can also experience facial pain or sometimes like a burning sensation in the limbs. And this is due to their sensory nerves being damaged, which obviously then in turn will impact on their functioning. But by applying pressure on painful areas and potential trigger points, massage can reduce the pain. It can also help improve flexibility, reduce muscle and joint stiffness, and this is by basically improving blood flow to stiff muscles and joints, and therefore in doing this it reduces healing time, recovery time, from sort of those flare-ups, that in turn will help improve mobility and functioning. And by doing this, actually regular massage can also help. It's not going to prevent people from having relapses, but it may just help to slow down the progression of the disease. Muscle weakness and loss of mobility may also cause muscle atrophy, which is where the muscle tissue basically dies off. So this causes further deterioration, but by increasing the circulation of oxygenated blood, increasing transportation of nutrients to the tissues, massage can help to prevent the atrophy and also improve energy levels. Reduce spasticity. Muscle spasms occur in MS really due to repeated contraction of the muscles, and this again causes difficulty in walking, poor balance, poor coordination, reduced fine motor movements. But massage can relax these muscles, reduce any tremors, and therefore improve range of motion and functioning. Stress reduction, obviously. Stress often triggers MS symptoms, as it does with any kind of chronic condition. But massage can offer relaxation, reduce anxiety and fear, which, are probably going to be associated with the MS a lot of the time. Massage also, as we know, stimulates the circulation, improves the blood flow at each level through specific techniques, which, as we've said, can, benefit in terms of, recovering from those relapses, and just keeping flexibility of the tissues. And obviously each massage technique can work on a specific area of the circulation. So effleurage will work on capillary dilation, petrissage, which is like your kneading techniques for the deeper arteries and veins, and frictions can work on those superficial veins. Another issue that may come up for MS clients is pressure sores due to the reduced mobility. Massage can help prevent pressure sores, again through circulatory stimulation. However, if pressure sores are already present, and it doesn't have to be like an open sore, massage is contraindicated at that point, but it can still work on, the surrounding areas. And also improved bowel motility is another area where massage can help. You know, I've spoken in other videos about how great abdominal massage is for the digestive system, for reducing constipation and just really helping improve that peristaltic movement of the bowel. So yeah, in that way, it's great for MS. Now, there are some cautions in terms of MS clients having a massage. So edema is quite common in MS clients, which is basically accumulation of excessive watery fluid in the cells, tissues or body cavities, possibly due to heart or kidney disease. But you know, the reason, if a client does have edema, the reason for this edema really should be identified before giving a massage treatment. If it's due to, say, heart disease, probably not the best idea to do a massage. But if it's resulting purely from the immobility, then mild massage can be really helpful. Obviously, if it's an MS client who is also pregnant, then definitely as a therapist you want to consult with the doctor or the midwife. If there's any other issues such as you know, any cancers, ulcers, enlarged liver or spleen, arthritis, again, you might want to be cautious as a therapist and just consult with the client's doctor. And also if there's any recent injury, you know, just take that into consideration as well. So I'm going to talk, obviously there are things just to be cautious of, but in terms of actual contraindications, reasons why you definitely shouldn't massage someone with MS. So if they have osteoporosis, and this could be due to corticosteroid use and restricted mobility. People with MS generally have lower bone mass and are at higher risk of fractures. So, you know, if they've got osteoporosis, which to be honest with any massage client, regardless of MS, you know, you wouldn't treat. If they have decubitus ulcers, localized massage would be contraindicated, but you can work in the surrounding areas. Any techniques or modalities which can cause fatigue should be avoided. Any painful techniques, you know, which to a certain extent you're going to have to play by ear with each client, but you know, deep frictions or any vigorous work will increase firing of the sympathetic nervous system, which is responsible for that fight or flight response and also promotes fatigue. So again, you're going to want to avoid those. Heat application, you need to be really careful of, particularly over a large area, because it will affect nerve conduction. And also there is increased risk of nerve damage or burns in those with reduced sensitivity or areas of numbness. And this again can cause fatigue. So certainly hot stone massage, absolutely not in an MS client. And also deep tissue techniques, which was sort of covered, are contraindicated where there is reduced sensation as well. Okay, so I'm going to talk a little bit now about sort of considerations for the therapist in terms of providing a massage treatment for the client with MS. Now, the type of massage therapy is dependent on the intensity and stage of MS that the client is in. Massage really should be avoided in the acute stage to avoid worsening pain. But you know, deep tissue massage is good for relaxing tense muscles and decreasing pain. But more often than not, you may want to opt for a Swedish, which is going to be much more gentle and certainly advised in the initial or end, of the acute stage, because even slight pressure may cause pain. Trigger point therapy can be beneficial in MS, maybe where deep techniques can't be tolerated, because even trigger point therapy doesn't have to be particularly deep. So that's another thing to consider, but again, it's kind of trial and error with each individual client. Certainly massage therapy is likely to be a lot more appropriate when the client is in remission. Avoiding hot and cold sensations, due to poor tolerance for temperature changes, and keep watching out throughout the treatment for inaccurate sensations. Be cautious in numb areas. Make sure that you spend plenty of time, to ensure, the comfort of your client. Really work on the positioning, which may sound common sense for a therapist to do, but it really is important with MS clients. If there is edema, you can use manual lymphatic drainage techniques. And also, even if you're not doing a sports massage, passive range of motion, sort of type exercises, doing those for the joints may just help to improve flexibility, even if you're just doing a Swedish massage. But again, obviously, you've got to work within your competency level, and that will just hopefully then reduce the need for those deeper techniques that may not be tolerated, because you're going to be using a slow, prolonged stretch to ease those contractures in the muscles instead. Generally stick to kneading, stroking and vibrations. You don't want any of the tapotement, and I'd say generally you probably want to avoid frictions as well. And yeah, just keep in mind as well the Golgi tendon organ in spastic muscles, which obviously is a sensory receptor organ at the origins and insertions of skeletal muscle fibres that basically detects changes in muscle tension. And it provides the sensory component of the Golgi tendon reflex. Now, in terms of what does the research say about massage for MS clients? Actually, the research says quite a lot. It does support that there is relief of anxiety and depression, improved mood, self-esteem and body image. It also shows improved physical and social functioning, and an improved image of, the progression of the disease, which brings with it an increased self-efficacy, i.e. sort of self-belief, that the person can cope with the challenges that they face in their MS. But obviously, the massage needs to be on a regular basis to maintain that effect. In terms of mobility, it's a little bit more vague. Research has shown that there is a slight increase in ambulation when there have been, regular massage treatments. But this has been a little bit inconsistent, and it's, it's going to vary from person to person. Also, in terms of if we think about the bowels, research has shown certainly reduced constipation, greater ease of bowel movements, less pain with bowel movements, and a more sort of, regular frequency, but also improved appetite, reduced bloating, and just decreased sluggishness with the bowels, which brings with it a reduced need for laxatives and improved energy levels. So, they have all been suggested as potential benefits as well. So, yeah, hopefully I have quite a quick video, but hopefully I've been able to show you that, even if you have MS, it's not automatically, a reason why you can't have a massage. There are still benefits. You just need to find a therapist who is experienced in dealing with this and who is registered and has some sort of qualification above the usual basic sort of diploma. But yeah, that's really it on MS. So hopefully that's been of some help. If you haven't already, feel free to subscribe to my channel. There's lots of videos already up on various physical and mental health issues, as well as pregnancy and postnatal, and lots of sports related issues, and also disability. Feel free to comment down below, or if you have any questions, you can contact me through the links on my Facebook or Instagram pages, and I will answer you. But for now, that's really it from me. So take care of yourselves, and I will see you next time. Bye.